Welcome everyone, and thank you for joining us today for Not Alone, How to Help Transgender Survivors in Detention, Part 1. My name is Carolina Aparicio, Program Officer at JDI, and I'll be your moderator today. JDI is a health and human rights organization that works to end sexual violence in all forms of detention. JDI has 3 core goals: to hold government officials and agencies accountable for sexual abuse in their facilities, to change public attitudes about sexual violence behind bars, and finally to ensure survivors of prisoner rape get the help they need to heal. We would like to take a moment to thank the Office on Violence Against Women for its generous support of this webinar and our larger project called No Bad Victims: Support for Incarcerated Survivors. So I just want to go over a few things before we get started. I want to remind you that some of what we're going to be discussing today may be hard to hear or upsetting, so please take care of yourselves. This webinar will be recorded, so you'll have an opportunity to revisit it later if necessary. You can submit questions and comments throughout the webinar using the questions box on the right side of your screen, and here's a little example up on your screen of what that looks like. The webinar is being recorded, as I mentioned, and we'll be posting that on our website, justdetention.org/advocate-resources, and that'll go up in the next few days. And it will be closed captioned. We'll send you more information later today in an email, including a link to an evaluation. We have a wide range of other resources available on our website for advocates, and we'll review those in more detail at the end of today's webinar. This webinar is the first part of our series on helping transgender survivors of sexual abuse in detention. The aim of this series is to help community-based rape crisis organizations and other service providers, like yourselves, understand the issues facing transgender survivors in adult and juvenile detention and ways that you can help these survivors heal. Today we'll cover the following: trans basics, including how to communicate effectively with trans people, the risks facing trans survivors in detention, and the prevalence of sexual abuse in detention for trans survivors. We'll hear from Kerri Cecil, a transgender woman who survived sexual abuse in a men's prison. We'll talk about ways that advocates can serve trans survivors in detention settings, and we'll end with some time for questions and answers. A quick note on some terms before moving on. While law enforcement, prosecutors, and victims' rights groups tend to use the term victim to refer to someone who's been sexually abused, they do this in recognition of the crime that was committed. JDI prefers to use the term survivor. We do this to honor the strength and resiliency it takes to live through a sexual assault and for that person to heal. The terms inmates and prisoners will be used interchangeably to refer to incarcerated people. If you have any questions about a specific term or anything at all about today's webinar, please use the questions box and a JDI staff member will assist you. So before we get started, I'd like to get an idea of what you are hoping to learn from today's webinar. And I'll just give you just a minute to submit your answers by typing that into the questions box. I'm seeing how to, just general understanding of trans people, ways to help. Great, lots of great answers. I hope that we get to a lot of what you want to learn today throughout our webinar. How to work with correctional facility to support survivors, how to make their incarceration easier. These are great and really indicate that we are talking to people who want to help. So thank you so much for being here today. We'll answer as many of them as we can throughout the webinar. And again, if we don't get to something, feel free to reach out to us afterwards by email at advocate@justdetention.org. So now I have the pleasure of introducing Michael Munson, who is the co-founder and executive director of Forge, an organization focused on improving the lives of transgender individuals by building stronger connections, providing resources, and empowering growth through knowledge. Forge is a national training and technical assistance provider funded through the Department of Justice Office on Violence Against Women. Michael's educational background is in psychology with an emphasis on trauma-informed care and non-traditional healing modalities. His work on violence against transgender and gender nonconforming individuals stresses the intersectionality between complex components of identity, experience, and societal constructs that can both spur violence as well as catalyze healing for individuals and communities. He is passionate about engaging professionals to embrace these complexities and learn key skills to better serve their clients and constituents. Thank you so much for being here with us today, Michael.
Thank you. I'm always muted. I have the opportunity to work with JDI, so I really appreciate being involved with this webinar, and I really appreciate, too, the work that JDI continues to do to support transgender issues and transgender survivors. So why don't we get started, and we'll talk about some trans basics. So let's just dive in and get going. We have come a really long way. We've moved from a place where what we knew about trans people were the sensationalized stories of Christine Jorgensen to a place where we see vibrant trans people in the news every single day if we're paying attention. We see people like Janet Mock, who's on the right side of your screen, who's part of the mainstream dialogue about gender and trans issues. We've also come a long way in terms of people are coming out at a younger and younger age. And people are also able to come out later in life and are also feeling free to explore their gender when they're older. We've also come a long way as we've moved from a place of pathology, where the Diagnostic and Statistical Manual has formally classified trans people and gender nonconforming people as having a disorder, gender identity disorder, to now where the DSM has shifted to calling it gender dysphoria and a bunch of other things. It's still pathologized, but a little bit less so. The quote on the screen is by Lynn Fraser, who was the president of the World Professional Association for Transgender Health. At a recent conference, she said, "No one's identity is a disorder." As we talk about trans people today, let's keep this in mind, that no one's identity is a disorder. So who are we talking about? Each of us brings with us a different mental image, theoretical framework, or academic construct about what transgender means and what we understand when we say the word transgender. I hope by the end of this webinar, whatever your current knowledge is or beliefs are, that you'll have a more expanded concept of who trans people are and how to work more effectively with trans clients. When we hear or see the words transgender or any of those other hundreds of words that might be synonyms or closely allied words, we each have an image that comes to mind. Each of us, if asked, would describe who transgender people are in a little bit different way. And that's a really, really good thing. So I'm not going to define terms because that will not help us understand who trans people are. Defining terms just gives us more labels to assign to people rather than truly understanding who each person is. So who are we going to talk about? Who are we talking about when we use the word transgender, or when we're talking about who's included under the very broad spectrum of people who may identify as trans or previously trans? We're talking about people who are gender nonconforming, or people who may intentionally or not blur stereotypical cultural lines of binary or the either-or gender. We're talking about people who transition from one gender to another. We're also talking about people who are questioning their gender or who may not feel like the gender that they were assigned at birth fits who they are today. We're also talking about including people who don't fit the binary, people who may identify with a gender other than male and female. We're also talking about people who are gender conforming, so people who may have a trans history, but who now view themselves as male or female and not as trans anymore. We're also talking about people who may have multiple gender identities or multiply gendered people. So they may live part of their lives as different genders, or they may identify as more than one gender. And at Forge, we talk about who's trans or who's in the trans community as also including significant others, friends, family, and allies. So on the screen in a second is going to be a word cloud, and I created this from one of our handouts on our website, which includes 101 words that some trans people use to describe their gender identity. There are literally limitless ways and words to describe transgender experiences and identities. Depending on how people self-identify or how others may impose an identity or a label on people, we don't really know what percentage of the population is transgender, gender nonconforming, or non-binary. But much of the research suggests that around 1% of the population is trans, keeping in mind that we really don't know what that number is. So this previous word cloud and the one that's coming up, the previous one has just a few trans-focused words. And that might have been overwhelming to look at. It might seem like trans people have a lot more words to describe themselves than non-trans people. So I wanted to provide just a little bit of balance. So I created a word cloud that was based on the word man and male. And as you can see, this is just a fraction of the words that people may identify with or have assigned to them if they're man or if they're male. So examples could be things like fellow or son or boyfriend, gentleman, Mr., metrosexual, father, lots and lots of different words. So we all have different words that we use to describe ourselves. So as I mentioned, Forge generally doesn't include terms and definitions when we train. And the reason that we don't give definitions is summed up in what we call the terms paradox. The terms paradox teaches us that on the one hand, identity labels and the like are absolutely critical. To be culturally competent, you need to find out what terms a person uses and then refers to themselves and then reflect those terms back to them. This use of a client's terms tells them that you respect their right to self-define and that you're listening to them. The paradox, though, is that the terms that people use are often less than meaningful for a couple of reasons. First, definitions and terms are really hotly debated within the trans community and beyond. They're discussed and they're disputed, again, both within the trans community and outside of it. And the terms are constantly changing and evolving. The second reason around the paradox is that what you really need to know about trans people in order to serve them appropriately likely isn't going to come from an identity term or a label that they've put on themselves. What you'll hear today will shed light on individuals, on experiences, on specific situations, on some areas where we might be able to generalize, but often it's not going to be generalizable because someone shares a particular limited term to define themselves. So last June, 2014, the Office for Victims of Crime released Responding to Transgender Victims of Sexual Assault Toolkit. And it was based on 11 core documents that were part of a grant that we were involved in. It was 450 pages worth of those 11 documents. And we worked closely with OVC to transform those documents into a more interactive online toolkit. The toolkit offers both 101 content and extensive transsexual assault-specific information for service providers. I really encourage you to take a look at it and explore what this toolkit has to offer. It includes many links both to Forge's website and to other resources. As you can see on this next slide, there's three basic areas in this toolkit. One is Transgender 101, lots of information about 101 materials. The second area is sexual assault in the trans community, so some ideas around statistics and other information there. And then the third main section is around tips for those who serve trans victims. So that may be the most interesting for a lot of people. So this next graphic on the screen is the core of the 101 presentations that we facilitate, and it's how OVC, the toolkit, organized the 101 information as well. As you can see from this image, it has some givens at the bottom, so sexual orientation and gender identity are some givens. And then when we move to the midsection, the second section is about choices or actionable items that trans people may take. So things like name or pronoun, level of disclosure, relationships, name and gender on documentations, gender expression, medical, legal, or social options. And that third section on the top is about kind of unchoices or the non-choices. So these are other people's prejudices, the ability for somebody to pass, which is a little bit of a contested word, or present as the gender that they identify as, and other people's choices or behaviors. So let me take a moment just to describe gender identity and gender expression. So first, gender identity is an individual's internal sense of being male, female, something in between, or another gender that's not necessarily visible to other people. We all have a gender identity, and for most of us, it's male or female. As we saw before, there are literally hundreds of gender identities. Remember that word cloud that I showed you a couple minutes ago. So gender identity is what is in somebody's head. It's how they view themselves and their gender. In contrast to gender identity, gender expression is how a person expresses their gender through clothing or grooming, speech, hairstyle, body language, social interactions, or other types of behaviors. This is what other people see. Of course, it's possible that others are not seeing what we might hope for them to see. They may be misreading cues that we're sending out. Again, we all make choices around how much effort we put forth to follow societal norms around gender expectations and how much time and effort we spend on looking a particular way. Again, there are hundreds of choices related to gender expression and other gender-related options. So sometimes pictures speak a lot louder than words. And I know that not all of you have access to the slides, but there are four pictures on the slide right now. And the people on the slide could be included under the trans feminine spectrum. You might hear these people refer to themselves as trans women, or women of trans history, or male to female transsexuals, or cross-dressers, or any number of other words. These are individuals who were assigned male at birth, but now identify or live some or all of their life in a more feminine way, either as female or expressing more stereotypically feminine characteristics. In contrast, on this next slide, you'll see these people may refer to themselves as trans men, or female to male, or stud, or drag king, or formerly transgender, or any number of other words. These people were assigned female at birth, but identify or live some or all of their life in a more masculine way, either as men or expressing stereotypically masculine characteristics. And this last picture-related slide is about non-binary or agender folks. The language associated with the images on this slide is shifting the most in the past several years. It's critical to keep in mind that not everyone identifies as either male or female, or even is heading in one of those two directions. Many people identify as multiple genders or no gender at all. Some people intentionally challenge the binary gender norms. There are many ways people can live and be that do not conform to gender binaries. People who are gender non-conforming, agender, or non-binary in their gender identity or in their gender expression have been assigned, may have been assigned either male at birth or female at birth, or sometimes in rare cases as intersex. They may or may not take steps to socially, legally, or medically transition. So for many folks, aligning gender identity and gender expression is very important. Some people who may use the help of three major areas to make that alignment. So social, medical, and legal. Every person makes unique choices with this set of options. Some people's goal is to transition from one gender to another, while other people may take action to reach a different point of emotional and physical wholeness, which may include a limited number of actions in these three areas. So social choices or transition, what that generally means is coming out or not coming out and creating a personal environment in which a person's gender identity is known and ideally respected by others, such as friends, family, and coworkers. Medical choices or transitions can generally involve things like hormones or surgical interventions, again, to align somebody's body more so with their gender identity and allow people to feel more comfortable in their own skin. And the third thing is legal choices or transition. So some people choose to change their identity documents to have a name and or gender marker that reflects their current identity. So in that first graphic with the picture of the person on it, the non-choices were at the top. So we haven't talked too much in detail about the choices and behaviors people can take around their gender. To learn more about those things, I encourage you to look at the 101 material on Forge's website or the OVC Toolkit. But I did want to talk about these non-choices for a second. So the first of these three non-choices include things like prejudice. So this can be from an individual or from a broader societal prejudice or structure. Passing is another thing that's not within the trans person's control or choice. A person may try to present their gender in a very specific way and anticipate that others will see them in the way that they wish to be seen. Unfortunately, sometimes others will see a person who's trans and will guess or presume that they're trans based on their appearance. For example, a trans woman might be wearing a dress, makeup, heels, and have other overtly traditionally feminine cues, but other people may still perceive her to be male. The third non-choice is about other people's choices. So this cloud encompasses many different choices, but it might be something like a trans person might not be in control if their boss decides to fire them because they're trans. So some of you might be thinking, I don't get it. A lot of times we get hung up on language, which, to be honest, is a really important variable in treating trans people respectfully. What is sometimes difficult to understand is that there isn't one list of right words or wrong words. The reality is that what's right is what your client tells you, how they refer to themselves, what language they've indicated they use, and they prefer for you to use as well. Conversely, that means that the only wrong language is using words and phrases that are intentionally in contradiction with what your client has indicated is comfortable for them and aligns with their identity and experience. So if there isn't a right or wrong list of terms and definitions to study and learn, you might be wondering, how do I get it right? And the answer is pretty simple. It's to listen really carefully. And sometimes that's easier said than done. And when we listen carefully, we ask relevant questions, we listen some more, we might ask some clarifying questions, but then we listen some more. We're going to be treating people with an incredible amount of respect and dignity. I wanted to leave you with a couple of quick resources. You saw the OVC Forge Toolkit on a previous slide. Our website is also another resource that is full of a lot of information, and I encourage you to check that out. And specifically on our website are webinars, and we have all of our webinars are recorded, and I encourage you to listen to them both by yourself or as an agency. One of the things that we're finding out is that a lot of agencies are listening to webinars as a group and then using them for jumping off points for deeper discussion with their colleagues and their coworkers. So I'd like to end the segment with this quote. Many of you will recognize Laverne Cox in this image. She has been a really powerful voice for trans people in her acting and activism, with her ability to provide clear and direct comments in response to ignorance and lack of education and understanding. From her role on Orange is the New Black to her very on-point and firm confrontation of people like Katie Couric, many of which you've seen that interview. So Laverne states, "It is revolutionary for any trans person to be seen and visible in a world that tells us we should not exist." Many of you may never have worked with a trans client, in part because it's so difficult for trans people to be visible in a world that says they shouldn't exist. I selected this quote too because not too many years ago it was a revolutionary act for service providers and professionals to be willing to sit in a training like this, to talk about transgender issues. Both trans people and providers are often faced with stigma and feelings of vulnerability. So thank you for being bold and for being here today so that we can all be more visible.
Unmuted.
Thank you so much, Michael. I think that's really provides such a great foundation as a lot of our listeners are going to be working with transgender survivors in detention. So I really appreciate that. I'd now like to take a look at some statistics and dynamics to help frame the issue of trans people and detention. The U.S. Department of Justice indicates that 2.7% of the U.S. population will be imprisoned at some point in their life. This figure, however, does not include jails. In other reports by the Bureau of Justice Statistics, the rate could be as high as 5.1% of the general population. This rate, however, is dramatically lower than the rates of incarceration that trans people face. In a very large-scale survey with over 6,400 respondents, the National Transgender Discrimination Survey reported that 16% of respondents had been incarcerated at some point in their lives. Many reasons contribute to why trans people have higher rates of incarceration. Based on literature reviews and reported experiences by trans people, we know that several factors increase trans people's risk of incarceration. Many trans people experience emotional, physical, and sexual abuse in school, which can lead to difficulties learning and even to many young people dropping out of school. Without a high school diploma or GED, employment options become extremely limited. In addition to bullying and other violence in school, trans youth may experience childhood physical or sexual abuse, or emotional abuse by family members. Families and communities may also reject young and older trans people in some cases, leaving trans people homeless. For those trans people who were able to finish high school or beyond, employment discrimination is widespread. These factors and many others may drive individuals into the underground economy, surviving through sex work or selling drugs. The National Transgender Discrimination Survey also found that over twice as many male to female individuals, 21%, are detained in comparison to female to males, which is 10%. The rates for those who identify as gender nonconforming is 12%. And we also know that a disproportionate number of Black trans women are in custody at some point in their lives. We know that trans people face discrimination and abuse at much higher rates when they're in custody. Trans people are often misgendered by the criminal justice system, meaning that policies and procedures that are defined by gender, like housing and searches, are very often determined by genitals, not by gender. Even if a transgender person has legal documents with their correct gender identified, if they have not had genital surgery, they're likely to be placed by genital configuration. Many trans people may not have had genital surgery for a variety of reasons. Trans people are often denied access to hormones and other trans-specific health care while incarcerated, as well as are often forced to change gendered characteristics of appearance in prison. This often results in mental anguish and increased exposure to harassment and violence. And Linda and Michael are will go over this in much more detail later today. And then finally, trans people are often isolated or subjected to increased sexual violence, harassment, and other types of abuse at the hands of prisoners and corrections staff. We've heard from many transgender women in custody who talk about the constant sexual harassment and humiliation they experience by staff and other inmates alike. Sarah, who identifies as a transsexual woman, told us, "The prison personnel seemed obsessed with making me a man. They denied me a razor so I could have a manly beard. They beleaguered me with gender and sexual slurs and chanted Mr. at me. They constantly told me that I have a penis while calling me John." So there isn't a lot of research available on a lot of widespread research available on the rates of sexual abuse faced by trans people behind bars. However, one California-based study found that close to 60% of transgender women in California state men's prisons reported sexual abuse by staff or by other inmates. That's compared to just 4% of non-transgender men. We also know from research by the Bureau of Justice Statistics that gender nonconforming people in women's prisons are targeted more often by staff. And similarly, more trans women experience sexual assault while incarcerated than trans men in actual numbers. Part of the reason for that is, as we showed just a few slides ago, that there are more trans women in detention than trans men. And the fact is, we don't know that much about the experiences of trans men in detention. There has been little targeted research, and the majority of trans survivors who we hear from here at JDI are women. We hear over and over again that in prison there's a presumption that transgender women want and seek sexual attention and therefore cannot be abused, while transgender men who are generally in women's facilities are a danger to women inmates. We know that trans people face more extreme kinds of abuse and harassment in detention. Some of these include demeaning language, such as the insistence on calling people the wrong pronoun or name, homophobic and transphobic slurs, both by other prisoners and by staff. They experience sexual harassment, including sexually explicit language, presuming that all trans people are sexually permissive, and comments and invasive questions about body parts. They experience abusive or inappropriate searches by staff. We hear about protective pairing, which is an arrangement where one prisoner exchanges protection for sexual and other favors. It's also called hooking up or choosing a man or a woman, and it mimics the dynamics of domestic violence in the community in terms of the power dynamics and the one-sidedness of the rules. And finally, trans people experience sexual assault and prostitution at much higher rates and often in more violent and extreme ways. So I'd like to share another quote from a transgender woman named Desi, who wrote to JDI about her own experience with what we call protective pairing. She said, "The options for me are to choose up with a husband that's both strong enough and respected enough to protect me, and with enough income to take care of me as his prison wife. Or I can be conscripted into a gang as a prison gang bitch and forced to have multiple sex partners who may or may not take care of me. So I try to choose the lesser of two evils." I think that quote is especially poignant when talking about the dynamics of abuse in detention for trans women in particular. So I now have the honor and privilege of introducing Kerri Cecil. Kerri is a transgender filmmaker and an outspoken activist for the rights of all transgender people. She recently produced a documentary called Transformed: Surviving the Dark Side of Hollywood, about the many struggles that transgender women face in order to survive. Kerri works for the Friends Community Center in Los Angeles as an HIV counselor and tester. And we've invited Kerri here today to talk about her experience in men's prisons in California and the abuse she experienced and observed while incarcerated. Thank you so much for being here today, Kerri.
Muted.
Thank you, Carolina. And I want to thank each and every single one of you for caring enough to be part of this webinar today. So I want to tell you a little bit about my story. I basically grew up on the streets of Hollywood. My family was not supportive, just like so many other trans people and their families. From an early age, I felt like I matter less in the world because I am a transgender woman. I was 18 years old when I first went to prison for second-degree robbery. I had been prostituting at the time, and one day I was drunk in the back seat of a car when my boyfriend of the time decided to rob one of my tricks. I was arrested and sentenced to prison. It felt like part of my soul was chipped off. I hadn't committed the crime I was arrested for, and once again I was being told that I didn't matter. Even my public defender was laughing at me in the courtroom because I was trans. I had already been on hormones for several years and was living my life as a woman. So you can imagine how frightened I was when they sent me to a men's prison. When I got there, I was blown away by the amount of violence and control that the male prisoners had over the transgender women. Gay and bisexual men were definitely targeted as well, but it was so much harder to hide who I was because I have breasts and I look like a woman. When I got inside the prison, I didn't know that I had been bought and was almost immediately by some of the men who were in the white gang. I was literally put in a cell with the highest bidder. That was what they called breaking her in. They wanted to break me so that I would make money for them. They tried to sell me as their property. I was brutally beaten for 2 weeks and raped until they had just gotten sick of me, and they just kind of threw me out. During those 2 weeks, I wanted to give up on life, but I didn't. There was something inside of me that chose to continue living. And once I was out of that situation, I saw that the other trans women were treated much the same way. Basically, we were property for whoever was the highest bidder. The craziest thing is that the officers knew what was going on in there and sometimes encouraged it. At that time, the officers abused and humiliated us as well. Countless times I was humiliated and stripped by officers in front of other inmates. And countless times they would pad search us in an unprofessional and violating way, knowing of course that we have breasts, but acting as if they didn't know. Trans people, we are targeted by officers as if we don't belong there, but at the same time they would tell us, well, you're here in a men's prison and we're going to treat you like every other male prisoner. The officers didn't want us there because obviously they didn't want to deal with our needs as trans women, specifically about getting us bras. Some of us started writing letters and 602ing, which is the appeals process, about the fact that they would have us out there being pad searched, ignoring that we have breasts, fondling them, violating us. Often, they would make us go out on the yard in our heavy blue uniforms in 100-degree weather just to cover up our breasts, instead of issuing us bras so that we could wear t-shirts or tank tops like all the other inmates. These are the kinds of things that are only recently just started changing. When I got out in 1995 from my first prison term, I started using drugs and ended up going in and out of prison for drug possession. And every time I would go to court, I was never given any real defense. No one was there to ask the courts to give me a break. I never had that kind of representation. So automatically I would get sent right back into prison. Trans people are really unrepresented when it comes to legal defense. During my last term in prison, gang members were attacking trans women and trying to make us pay taxes and rent to be on those yards and forcing us to prostitute for them once again. That's when I started reaching out for help. I contacted an organization called the TGI Justice Project, which stands for Transgender, Gender Variant, Intersex Justice Project, to let them know what was going on inside Avenal Prison. And then I also reached out to JDI and I explained that I was a survivor and told them about what had happened to me. I also told them about another officer who was fondling me on the yard and saying that because I was a male inmate that I didn't have a right to protection of my breasts. What I experienced by that officer became so synonymous with sexual harassment that inmates would say, "What's up, can I get a Brown?" Because his name was Officer Brown, meaning could they touch my breasts? I had no defense against that. So I would write appeals and JDI would tell me about some options that I had. Of course, it got denied all the way up to the top level in Sacramento. I was told that I am a male inmate and the officer has the right to search me at any time and on any part of my body. I still didn't have any family or anyone on the outside. So when I started receiving letters from JDI and other organizations, it began to affect how some of the officers would treat me. I could see the difference when they would bring me legal mail from JDI. They would look at me from the corner of their eyes like, "Oh, we can't mistreat this person anymore." Just receiving mail gave the officers the impression that someone on the outside cared about me. Right after that had happened, I was transferred to another prison, and they knew there that people on the outside were supporting of me. During a pad search one day, one officer said really loud so that everybody could hear, including the other officer, "I'm going to touch you now, and I just want you to know that I'm using the back of my hand to go around your breasts." While there were some small improvements on how certain officers were treating me, they were still putting some of us trans women in cells with rapists who could really physically hurt them. And the women were told that if they wanted to get out of the cell, they would have to cut themselves. So we had a few trans women who actually did cut themselves just to get out of those cells because they were constantly in danger. Fortunately, the rapist that they put me in the cell with happened to be half my size. So I wasn't physically in danger. I was just perversely in danger because I would wake up with him doing crazy stuff while I was asleep. But as far as physically, he could not overpower me. Some of the other trans women had it much worse than I did in that prison. Trans women go through so much in prison, and we really need emotional support just to know that people out here care about us. That means more than you know. We need to know that we're not forgotten. Excuse me one second. That we may have made some mistakes, but we don't deserve to be sexually harassed and abused, to be treated as if we are less than human. People degrade trans people on the streets, so it's not surprising that we're treated even worse in prison by a bunch of people who are in there for hateful crimes, or officers who are callous towards inmates in general. I remember my first time going into the prison at Old Folsom, 1991. They had a hill on the outside of the prison with all of these sticks sticking out of the ground. Those sticks had numbers on them. I asked somebody about it and they said, "That's where you go if you're killed inside of here and nobody claims your body." That stuck with me the entire time. I kept telling myself, whatever you do, Kerri, try to survive because nobody will be able to claim your body. And that's why we need to give transgender women hope in there. There are so many dangers that many don't survive inside of prison. I urge you to just take a minute and listen to some of the women's stories and show them that you care and that they have somebody out here who's just not going to let them be raped and murdered in prison. It means so much just having somebody come and see you or write to you and acknowledge you, especially because you're in such a dark place for so long. Just having somebody who would take the time and see us inside of there speaks volumes. That would be totally amazing. It's so important to have the ability to have a connection with a human being after something as traumatic as sexual abuse or sexual assault. That would be a huge step. To this day, whenever a trans women are sexually abused, we are locked inside of a cage in administrative segregation. It's literally a cage inside of a cage, no bigger than a dog kennel. And when we do get to talk to a counselor, we are made to feel as if we brought this on ourselves. We are forced into handcuffs inside of this tiny cage, which makes us feel as if we did do something wrong, even though we were the victims. We are still treated as dirt. We need support from someone who doesn't see us that way. It's courageous to even come forward and report that we are raped. There are so many dangers inside prison for snitching. So for us to be treated this way after we are raped, it really takes a lot for us to deal with. Think about all of the trans people who don't feel safe to even report it because of the way we are treated when we do report it. I wish that all trans survivors could meet with a counselor in a room and actually just have a conversation instead of being put inside of a cage. Excuse me one second. Oops. Instead of being put inside of a cage that only further dehumanizes us. I'm so sorry. I'm a little sick. I think that would be a huge step forward. People who are victims of hate and rape inside prison are re-victimized by the system all of the time. I just want to reinforce that whatever support you can offer will help, no matter how simple. Just knowing that someone believes and cares can feel like everything in there. Thank you once again for participating in this webinar.
Unmuted.
Thank you so much, Kerri, for your courage to speak about your own experiences. I know that it can be challenging, and your strength and your courage and the strong voice that you have, especially for when talking about all the other trans people who are behind bars. It's really powerful and amazing. So thank you for joining us. And Kerri is going to be around for the Q&A session later on today. So before we move on, let's make this a little more interactive. I'm going to give you just a few seconds or so to answer the following poll, and if you just bear with me for a minute. Let's see. What are some challenges that trans survivors often face in detention? In just a few more seconds. Great, and of course, you can select the answer on your screen. Great. So here are your answers, and the majority of you said all of the above. Limited access to medical services, little control over one's body and self-expression, and being isolated after reporting abuse. And all of these are definitely, we're going to go over in a great detail in the next section of our webinar. So thank you so much for participating. So now I'd like to introduce Linda McFarland, one of our Deputy Executive Directors here at JDI, and then Michael Munson again from Forge, who'll be talking through some of the challenges of providing services to transgender survivors in detention. Linda and Michael, over to you.
Muted.
Thanks so much, Carolina. So Michael and I are just going to talk through some of the challenges and opportunities as well with helping transgender survivors who are incarcerated, and hopefully through this next conversation we'll answer some of the questions that some of you had posed at the beginning of the webinar.
And I wanted to say before we enter this conversation, I just really appreciate Kerri's story and thank you for sharing it with us. I know that I'm really touched by it, and I have a little bit of a cough, but now I have more of a cough because I was really touched and crying. So thank you for being willing to share. So like Linda said, we want to just kind of have a conversation around some of these challenges and what people can do. So why don't we start with when people are not in detention, they have a lot of choice or control around their appearance, as well as if they pursue things like medical options related to their gender. So I'm wondering, Linda, if you can talk a little bit about what range of options trans people have with their gender presentation while they're in detention. So I know this can vary a lot from facility to facility, but I'm wondering about things like clothing options that people have, if they're allowed to keep their hair in a specific way, if they have access to razors or makeup, if they can grow a beard, or if they have access to things like prosthetics. So binders for trans men. I heard in Kerri's story things like wigs, which are not necessarily prosthetics, but you know, things that people may need every day.
Yeah, I mean, as you said, it really varies a great deal from facility to facility. But I think one striking thing in many detention settings is the lack of ability to control external aspects of gender expression. It really is changing in some places, and some facilities have worked hard to make the environment healthier for transgender individuals, but again, with a little more flexibility and recognition that this is a real need, but still I think many transgender people don't have access to gender-appropriate grooming supplies or undergarments. And it's really just one more traumatizing aspect of incarceration. And on the other hand, I think many transgender people are extremely creative about finding ways to create makeup, style hair, deal with a beard, or alter clothing to express their gender despite the lack of any kind of formal supplies. And to be honest, I've only really heard of one or two facilities even acknowledge that access to prosthetics is an issue to be considered. And then that would usually be something that would be referred to the medical department.
Yeah, and you mentioned the medical department, and I'm wondering what kind of options trans people have in detention around access to things like hormones or other medical services related to their gender.
Well, this really varies as well. I think that prisons and larger jails tend to have more services than smaller jails. And if they have a full medical department, they may be able to at least provide hormones and some additional care. But it does seem to usually, and well, I mean, it's generally accepted now that continuing hormones is best practice. But for people who haven't had a formal prescription or a community doctor who confirm their needs and provide records, there can be delay or even a refusal to prescribe hormones. So for people who may have been obtaining hormones on the street, they won't have that documentation. I think that most facilities who prescribe hormones do tend to stop there, and most departments tend to stop there. But transgender prisoners across the country are really pushing this and their need for more comprehensive medical services, and are getting some support and traction from organizations like Transgender Law Center. Kerri mentioned TGI Justice Project, the National Center for Lesbian Rights, and the National Center for Transgender Equality are some of the ones that spring to mind. And there are actually several lawsuits emerging around trans-specific medical care.
Yeah. One of the things that we know is that trans people who are restricted from expressing their gender can and do experience higher rates of suicidal thoughts and actions, as well as may have other behavioral challenges, either really withdrawing or isolating, or acting out in more confrontational ways. For survivors of sexual assault, it can be really important to have some sense of control over their body, both in terms of both clothing and appearance, and access to hormones, which, you know, as you mentioned, are sometimes not allowed. Can you talk a little bit more about if or how the risks change when a trans person in detention expresses their gender more freely? For example, if a trans woman grows out her nails or is allowed to wear makeup or has, you know, things like more feminine walk or longer hair, do these kinds of things increase the likelihood of violence or sexual assault? And what's the balance between the expression of authentic gender and authentic self and the potential for increased violence?
Yeah, and I think it really depends a lot on how the facility approaches it, right? Clearly, some facilities believe that denying gender will make a transgender person safer, sort of saying just don't sort of be that way and you'll be safer. Don't draw, if transgender people aren't able to fully express their gender, that they'll draw less attention and be in less danger. And on the surface, that can seem to make sense. And certainly some transgender people inside make that very hard choice to try to draw less attention. But there's actually no evidence that in facilities where people feel safer and more empowered to express their gender that they are safer, are less safe. There's no evidence that they draw attention to themselves, so to speak. It's really all about the environment of respect that's created, and living in an environment where their gender is denied, as you said, is very harmful and traumatizing in and of itself. So that creates danger, right? And then the danger to transgender people comes from a culture that devalues them, and denying their gender only further marginalizes them and again creates more danger. So facilities where transgender people, and frankly all people, are treated with respect and dignity are safer overall.
Yeah, and and what you bring up is kind of the sense of being authentic and getting to be who we are. I'm wondering about what people are using in terms of names that align with their identity, and if they're using their names assigned at birth, or what's the possibility around that? Because I know it's really painful for trans people to constantly hear a name that doesn't resonate with them, a name that they don't prefer to be be called. So I know that you were telling me a story the other day about this, and I'm wondering if you could share that a little bit.
Sure. I mean, I do think generally that, again, relates facility to facility. Many facilities insist on using sort of a legal name that the person was arrested under, regardless of how they identify, and even if they might have some documentation. And on the flip side, on a facility that has really made some strides in this, I had recently done some work in a jail in Washington State, and the staff had gone through training about effective communication with LGBTI prisoners, which is required by the PREA standards, the Prison Rape Elimination Act standards. And I was able to spend some time talking privately with a young transgender woman there. She'd been incarcerated previously, so she was able to compare this experience now to other incarcerations. And she shared that the staff at this jail referred to her as she, or by using gender-neutral language. And she noticed that they tended to use the more gender-neutral language, such as last name only, in front of other inmates, and she and her chosen name in front when it was one-on-one. She also said that they asked her where she would feel most comfortable being housed, and what gender staff she preferred to do pat searches of her. And she said that really these things made her feel much safer and much calmer. The staff also reported that she was much calmer and had fewer disciplinary issues than her past records would have suggested to them that she would. And they linked this, they fully believed that it was because they had learned to communicate effectively and respectfully with her. One challenge she was having strong reminders of past sexual abuse from when she'd been in a youth facility. And so she came into the jail feeling alienated already, a sense of disassociation from herself and from her body, which I know we'll talk about that feeling a little bit more later, even though she felt safe in this particular jail. And because she'd told staff that she was feeling suicidal, she wasn't allowed to have a razor in the jail cell and had grown a beard. And she described that along with feeling triggered by being incarcerated because she'd been abused in the past, the sense of her own identity that she'd developed as a young adult had been further harmed by feeling and seeing a beard on her face. And I was able to, after talking with her, communicate this to the staff in the jail. And they understood and agreed to let her shave, of course supervised by a staff member so she wouldn't be able to use the razor potentially to harm herself. And it just really brought home to me that there are corrections officials out there who are working hard to make facilities safer, and advocates can really be a part of helping survivors and helping transgender prisoners by finding those allies inside and by supporting their efforts. Sort of to that, I think kind of on that note, rape crisis services have been outside the standard delivery system by design. They're not psychiatric services. Rape crisis advocates aren't part of the investigative team. It's been more of a peer support model, people whose only goal is the well-being of their survivor. And I think this can be very comforting for transgender survivors who may have experienced the standard mental health professional, so legal, as gatekeepers to services and things they need, or certainly in the case of medical and mental health, to have pathologized them. And so I think for a lot of advocates, this really can feel like uncharted territory to work with transgender survivors. And a lot of transgender survivors, as Michael has mentioned, don't feel like advocates are necessarily there for them. So Mike, could you share a little bit about how advocates can make themselves more accessible, for instance, by asking about a survivor's name and pronouns?
Definitely. It can be incredibly validating and empowering for trans people to have somebody ask about their name and pronoun that they use. So asking can be really simple, and it can be a normalizing process, especially if you do it with all the survivors you work with. And it sometimes is very relevant for non-trans survivors as well as, or non-trans folks as well as trans folks. So for example of how you can ask, you can say, I ask everyone what name they would like to call me. Like, some people prefer to be called Bill versus William. And some people have names that are totally different from their legal name. So what name would you like me to use? So it's a really simple way that it tells people why you're asking, and it normalizes the process. It doesn't imply that you know that they're trans if they aren't out to you yet. And so it's very simple and easy. So if you hear a name, if they respond and say, you know, call me whatever it is, but if you hear a name that's substantially different from the name that you have on their paperwork, and it sounds like it might be of a different gender, you can ask a follow-up question like, well, what pronoun would you prefer me to use? What pronoun would you like me to use? Do you like he or she or another pronoun? So keep in mind that not everybody is going to tell you at the first meeting all of the details of their life and disclose their transness or what name they'd like to be called, because it can feel really risky and exposing. If you know or have been told that this client is transgender, you may want to ask again the next time that you meet them. You know, making sure that they know that the door is always open to talk to you about what they prefer and any other trans-specific concerns that they might have. You may want to insist, at least in private sessions, that you really want to use their chosen name. Transgender prisoners are often so used to being misgendered and called the wrong name that sometimes they might not even believe that you will respect them by using their name and pronoun. It's also really critical to ask where they feel comfortable and safe for you to use their name or pronoun that they tell you, since it may just be something that they want between the two of you and not used around other staff or inmates.
Yeah. Thank you, Michael, because I really can't, I don't think we can overstate the importance of making it clear that you see someone authentically as who they are, and certainly your language is one of the primary ways you can do it. Because that experience for some can be healing in ways that you might not predict. I was doing some counseling with a transgender woman who was a survivor of sexual abuse who'd been in prison since she was quite young, and she told me that myself and another rape crisis advocate were the first people who she believed had ever seen her truly as a woman, and that was a gift, she said, that would help her to protect herself and to advocate for herself. And honestly, it wasn't extraordinary what we did. We simply listened, we used her chosen name and pronouns, and respected her own description of her identity as true. And really, these are things that all well-trained rape crisis counselors would do. I also worked with a transgender man who was housed in a women's unit, and he was so used to his masculine identity being seen as negative and aggressive, or as that he was putting on an act, that when he wasn't treated that way in our group we were doing, he was surprised to the point of disbelief at first. But it really didn't take that long for him to trust that our respect for who he was genuine.
That's really interesting, and I know trust is a really big issue for a lot of folks. And many trans survivors in detention may feel less trusting of talking to staff or medical or mental health providers who work within the detention center, especially if they're not out as trans to those staff. So I'm wondering if you could talk a little bit about what some of the options survivors have who are in detention. So does talking to an outside advocate, would that allow for more disclosure, like you kind of implied above? Or, you know, what options do people have?
Yeah, absolutely. I think especially if an outside advocate has a good rapport with staff, for example, they can help to educate staff and advocates and advocate for their clients that way. And often, honestly, staff will be relieved to have some tools. The Prison Rape Elimination Act standards do require that staff get education and effective communication with lesbian, gay, bisexual, transgender, and intersex prisoners, and advocates can certainly help with that. The PREA standards also require that all facilities provide access to outside support services related to sexual abuse and harassment, and that they do that through addresses or hotline numbers. They also require that inmates who disclose that they've been abused in the past be referred for a mental health evaluation. And what I've seen is that when transgender survivors know that the help is there and that it's accessible, they do reach out. And again, at JDI, we hear from transgender survivors daily. It's important also to remember, though, that survivors have the choice about what they'd like to do post-assault, and having that control is critically important. And it's also important that they not be judged for the decision whether or not to report or reach out for help. And I do want to say that I think that if it's an outsider who's offering that help, as you alluded to earlier, Michael, there's a lot less fear of retaliation and possible repercussions, certainly at first. And I think Kerri mentioned as well earlier that when survivors know that someone from the outside is paying attention, they often feel much safer, and the facility staff often react to that as well. Sort of moving back to after the abuse, if someone reports, if they would like to pursue evidence collection, be a part of an investigation, including a forensic exam, and also to receive medical treatment for injuries or for prophylactic care for sexually transmitted infections, HIV, potential pregnancy. It's important to give the survivor, as an advocate, clear, simple information about what the forensic exam may entail. Also ask the survivor what they need to know, what questions they have, what concerns they have, and that if you don't know the answer to their questions or concerns, check with others, get back to them. Ask the survivor what they would like and what they need from you as an advocate, just as you would with anyone else, to help make this process easier for them. But keep in mind that for transgender survivors, there may be sort of different concerns, perhaps higher levels of anxiety or fear around this kind of a medical exam, and Michael's going to talk about that more in detail in a minute. But remember that corrections facilities are required to provide care that's equivalent to the standard of care in the community, and many of them are struggling to find ways to do this. So this is another way you can help. But this usually does mean taking survivors to outside hospitals where you're probably already providing these services in the community anyway.
Yeah, what you said is just so critical, and of course, not everybody does want to pursue forensic evidence collection. But for those that do, I think it is so important to ask, for advocates to ask survivors what they want. Since those, it's just really important to ask. For trans survivors, they may want the advocate to talk with the healthcare provider about the name and pronoun that they use, or to tell that healthcare provider that they're trans. And some people may not want that to transpire, and so that's how the advocate can help in that way. Sometimes trans survivors want an advocate's help in telling a forensic exam nurse or physician that they would prefer to not use specific language to talk about their body, but they might feel more comfortable, for example, showing somebody on a diagram or on an anatomical doll what might have happened or what part of their body is in need of attention. If someone is using pronouns and names other than what a client might want, there's maybe some disconnect between the providers using legal documentation names, the advocate can definitely help step in and make the correction of name and pronoun if the survivor would like that. And even if that medical provider is not willing to use the survivor's language, it can be very validating and empowering and supporting to the survivor if you as an advocate continue to consistently use the survivor's language. The survivor is going to hear that, and they're going to know that you're trying to create a safer space, in a space that may not be as safe as it, we'd all like it to be. For some trans survivors, they may not want the medical provider to know that they're trans, and they might prefer to go into the exam presenting as the sex that they were assigned at birth and just not disclose at all. And obviously any of those choices is very valid and may help them feel safer and more able to go through with things. Some trans survivors have had a lot of shame around their body in addition to feeling shame around being a survivor. And they may not wish to have you in the exam room at all. And as with all survivors, it's really important to follow their lead and respect the choices that they make, since so much has already happened that's taken away control from them.
Yeah, I mean, like you're saying, there can be a lot of shame around bodies. I mentioned certainly a lot of fears of loss of control. And for sexual assault survivors, it's often magnified. How does this play into what choices trans survivors may make around exams and evidence collection?
Yeah, right. Shame is often, true for all survivors or many survivors, but trans survivors can really feel disconnected from some parts of their body, specifically things like their chest or their genitals, and they may not want anyone to touch or see those parts of their body. Survivors obviously have the right to determine what level of evidence collection or medical care they receive. So just to give an example, a trans woman who may have a penis and may not want to have her genitals swabbed as part of evidence collection, but she might be okay with having her anus examined or swabbed. So that's one example where she's kind of given the choice or asserting her choice in what's okay with her body. So this might be a really good time to mention a couple of other things that we haven't talked about yet. And one of the things is that we don't talk about trans men. And I know we've briefly mentioned trans guys a little bit as we've talked, but if a trans man or anybody who has an ovaries or uterus is assaulted, and there's a risk of pregnancy if there was vaginal penetration with a penis that ejaculated. So one of the things that advocates can do, it's really important maybe for advocates to step in medical situations to remind medical providers that maybe they should screen for pregnancy, or even better yet, to offer emergency contraception since pregnancy is a possibility. And the other thing that I wanted to mention here around forensic exams is one of the webinars that we did about a year ago, and we had a guest speaker, Kim Day from International Association of Forensic Nurses, and she is just a dynamic speaker, and she in that webinar goes into great length about how forensic nurses can work really effectively with trans survivors. So I really encourage people to look at that, and we also added a document that kind of highlights in the SART safe protocols those trans examples and how those play out a little bit better.
Yeah, great. And you can see the resources here. The links, if people are interested, are on the screen right now. And certainly you'll have gotten those in your slides early on. So thank you for that, Michael. And moving on to, we all know that sexual abuse, sexual assault certainly affects people's thoughts about sexuality, and when we're talking about sexual abuse in prison, we need to think about that. And honestly, transgender people are subject to both curiosity and assumptions about their sexuality, and that happens in the community, and I think it's magnified in prisons and jails. Transgender people express and experience their sexuality in a range of ways, just like everybody else. And I think prison and jail staff, like many people in the community, aren't always sure of how to distinguish between gender identity and sexual orientation. And then you add on to this that in prisons and jails in general, it's difficult for people to talk about sex and sexuality. Sexual behavior is not allowed, and yet many people assume that all transgender people are open to having sex with anyone. As Kerri mentioned, transgender women's sexuality in prison is often seen as simply a commodity, and these kinds of assumptions and experiences create yet another barrier for transgender people to feel safe in coming forward for help.
Yeah, it's really interesting that you remind us all that sexual behavior is not allowed, but, of course we know that sexual behavior is happening in detention. Mm-hmm. And in my experience, I've heard a lot of trans women, more trans women than trans men, talk about how they do want to have that added perceived protection mm-hmm. while they're in detention, and may overtly decide that they want to exchange sexual favors, sexual behavior with one or more people in order to possibly minimize the risk of violence or sexual assault by other inmates. For some trans women, too, I know that deciding to engage in sexual behavior is one way that they can validate their gender identity as female. But that's, another topic that we can talk about some other time. I'm wondering if you could talk about the choices that some trans women make to engage in sex in exchange for protection, and what happens if this arrangement ends up not working out so well or ends up in assault.
Yeah, I think as you point out there, for many trans women in prisons and jails, it feels like the only option to have that perceived layer of protection if they're going to have some sort of safety. Often the person will be another inmate and sometimes a staff member. And we do hear that the experience can run the gamut from a relationship that is perceived, or it certainly at first seems, beneficial to both parties, to something very overtly abusive where the trans woman feels trapped in the relationship and is unable to escape. And these relationships tend to mirror domestic violence in the community, where one person has all of the power and control. And when the transgender woman wants out, that's when she can be and often is subjected to the most violence, the most danger. We also hear that staff and officials often don't respond well to transgender women who are trying to get out of these relationships, don't take their attempts to get help seriously because they believe that they were consensual to begin with. And then there's the same sort of victim blaming that the advocates on this call are familiar with happening in the community. We do also hear about transgender men that when they're trying to get out of these kinds of relationships as well, they're not believed, often because it's assumed that they're the aggressor, especially if the abuser had a more feminine presentation.
Well, and I'm glad that we have talked about trans men, and I think it's really important for us to talk about both trans men and trans women. I was wondering if we could make a couple of points about, so we don't miss them. And I'm wondering if you could share a little bit about how trans people are assigned to gendered facilities. I know we've made a couple of references before today about it, but I know Priya has some suggestions. But is it still common that genital sorting, in big air quotes there, is still used as the primary method for placement?
Yeah, that's true, and I do think this type of thinking is shifting, though we're not at a place where gender identity determines placement. The PRIA standards have given advocates some important tools to use. The PRIA standards do require that an individual determination about the best housing be made for each trans person, and that trans people be asked about their own perceptions, their own preferences for housing, and their perceptions of their own vulnerability, and that has to be taken seriously. Also, transgender people's housing needs to be reevaluated at least every 6 months to make sure that it's appropriate. So we're not there yet, but there really have been some significant shifts. Still, as Carolina mentioned, genital sorting, again in air quotes, is the starting point still in a lot of facilities.
Yeah, that's really interesting. And, we worked with a family of a trans man, and this may have been, this was a couple years ago, so maybe, and hopefully things have shifted since then. But this trans man was incarcerated in a women's prison, and the choice of his placement was determined solely by staff, and he wasn't asked, he wasn't allowed to have a say in where he felt the safest or which gendered facility he preferred. So it's interesting to hear what you're saying about evaluation and asking folks. What was interesting in this case, though, is that he may have been safer in a women's facility, but for him, his gender identity and being seen as male every day was far more important to him than his safety. So while he was in the women's prison, he ended up getting really depressed, and he also started acting out in physical ways, which resulted in him being placed in solitary. And when he was initially entered the facility, he was not allowed to continue on hormones, which he had been on for many years. So, it makes me wonder if this shift in hormones and in being placed with women when he didn't feel comfortable there could have contributed to his depression, either biologically or psychologically.
Mm-hmm.
So I think we're going to shift and do some very simple 4 points around some tips for advocates. So we wanted to just end with these points. So the first one is simple actions can have a big impact, and we've heard that a couple times today. So like Linda mentioned before, the simple action of using someone's correct name and pronoun, or finding a way for a trans woman to get access to a razor to shave her face, all of those simple actions can have a profound impact on trans survivors' lives. The second thing is looking at a whole person. So it's vital to all survivors to be seen as whole people. One of the things that happens frequently with trans people is that others focus extensively on their transness. Keep in mind that the survivor probably has assault-related needs that are their primary needs. So don't make being transgender the issue if it isn't the issue for the survivor. The third thing is around listening. So it definitely brings me back to that reminder of listening to our clients. So listen carefully and ask only the questions that are relevant and necessary. Trans people are routinely asked invasive and inappropriate questions. So, if we think before we speak about if our questions are about curiosity or if we really need to know the information to provide good service. And the fourth thing is probably, to me, the most important thing, and that's compassion. And it's compassion with persistence and kindness. Trans people both in and out of detention often experience daily harassment, discrimination, violence, and other types of injustices. It can feel really overwhelming to live in a world that is so harsh. So for many, it's a rare thing to be treated with kindness and with respect and with compassion. And you can make a huge difference both in their day-to-day life as well as providing them with an opportunity to see that people actually can and do care about them when you simply show some human compassion.
Unmuted.
Thank you so much, Michael and Linda. I think that was just a lot of really rich and useful content for our listeners. And so these are just a few resources that might be helpful for you as you work with incarcerated trans survivors, including the link to Michael's organization, Forge. A lot of really, really great useful content there. Black and Pink is another organization that provides resources for advocates who work with LGBT inmates. And the Center for Constitutional Rights is yet another great resource. And I know that we've kind of sprinkled other resources throughout today's webinar, which I hope will be useful to you. And then we can't encourage you enough to check out Forge's online toolkit, which can be found at this link. Really great stuff there, I think, as Michael went over earlier. And I also want to encourage you to view JDI's publication, Hope Behind Bars, an advocate's guide to helping survivors of sexual abuse behind bars. A lot of the stuff that we went over today is in there, and it's free and can be found on the Advocate Resources section of JDI's website. It includes general tips on working with incarcerated survivors, as well as more details about working with trans survivors. If you have any questions or need technical support, you can always contact us at advocate@justdetention.org, and we'll get back to you within about 2 business days. We also encourage you to visit the Advocate Resources page on our website for a wide range of archived webinars, fact sheets, sample MOUs, and other helpful resources. And that link is justdetention.org/advocate-resources. So now I'd like to turn things over to my colleague Camila, who will go over some of your questions. Camila?
Hi, thank you, Carolina. We have a few questions, and we've got about 10 minutes. So if you have more, you can submit them now. The first one is from Jennifer, and she had some questions about the PREA standards, specifically ones that apply to transgender inmates. And this was in response to the part from Kerri's story about the degrading searches by male staff. And she says, can trans women be searched by male guards just because they're in male prisons? Is there a PREA regulation that says that that can't happen? I'll refer that one to Linda.
Sure. The PREA standards say that that all staff members should be trained in how to search respectfully and professionally a transgender inmate. And they also say that the PREA standards say that a transgender's own preference about the gender of the person who should search them should be taken into account when that decision is made. So the standards do not come out specifically saying that transgender people can or cannot be searched by any gender of staff. The determination about what is the most professional and respectful way to search a transgender person is supposed to be individual. And you can see some guidelines around searching people of the opposite gender from the staff member and searching transgender individuals in the PREA standards 115.15.
Thank you, Linda. I hope that answered the question. There's another one from Amy, and she asks, in general, how do you deal with or address gender stereotypes or biases that you may encounter when you're working with correction staff or law enforcement? I will refer that one to Linda as well.
Actually, I was going to ask Michael if he wanted to take that.
Great.
I was hoping that you would. So.
Oh, okay.
Yeah, I think you're going to have a better answer, I think.
Okay, sure. So, I think in terms of addressing gender biases, one of the things that when working with law enforcement or corrections that we've tried to do, and honestly Forge has a lot of great materials around this, is really start with some basics around understanding language, how to use language, how to be respectful, how to be professional. I honestly think that one of the main things to really latch onto is a sense of professionalism, and a lot. This is one of the places where advocating with a facility, I think, it has to come from leadership, and that could be formal leaders at the top, or it could be informal leaders in terms of trainers or staff members who have some influence to say, these are the basic expectations of this job. You know, you don't have to change your views if you find this problematic, but what you do have to do is behave this way. Of course, it's much more genuine, and it works much better if they can fully treat and see transgender prisoners as fully human and deserving this treatment, which is of course where we want to go. But in terms of safety for right now, we often, if we're concerned, start with, you have to do your job, and here's what that means here. And go back to that basic professionalism. And again, I think presenting it as a way, as these are tools that will help you do your job better, with less stress, with less problems in your facility, and safer for everybody, inmates and staff alike, is really often where we find people grab onto that. I hope that answers it. But there's lots of materials that are out there for help.
Thank you. We have another follow-up question about searches, and this one is from Kathy. She asks, do heterosexual or cisgender inmates get to choose the gender of an officer to pat them down?
Well, it depends on what sort of facility they're in, what the guidelines are at. And again, these are the PREA standards are being applied across the country sort of as we speak. They're not in place everywhere. The PREA standards have a phase out of allowing male staff to pat search female inmates. They do not have a blanket ban on male staff female staff pat searching male inmates. There's a lot of reasons that the Department of Justice made that decision that I think are kind of outside the scope of this webinar, and I'd be happy to go into those online. In youth facilities, there's a blanket ban on cross-gender pat searches, however. Again, phasing in.
Thank you. Let's see. We have another question from Mariana from Los Angeles LGBT Center. And this one, I think Linda or Michael might be able to answer. So she's an advocate working with many immigrants, and she asked if there is any data regarding transgender individuals in immigration detention facilities. And she adds as a comment that it is very important to take into consideration culture when you're working with transgender immigrants.
Linda, do you want to address that?
Sure. I mean, I'm honestly, I'm not aware off the top of my head, Mariana, but it's certainly something we could check into around data regarding transgender individuals in immigration facilities. We've certainly worked with and provided support to a few individuals, and you're absolutely right. It is important to take culture into account when working with transgender immigrants, survivors who are immigrants and are in detention. The Department of Homeland Security is in the process of implementing their own version of the Prison Rape Elimination Act standards, and there are protections for transgender immigration detainees in those as well. And those standards, I believe, are available at the Department of Homeland Security website. But I'm not sure. I mean, in our experience, anecdotally, transgender individuals in immigration are at very high risk of sexual abuse. But the kind of research that was done in prisons and jails was not done in immigration facilities.
Thank you, Linda. That looks like all of the questions that we have for now. Oh, I'm sorry.
I would love to just point out too and thank folks, and I want to make sure Kerri hears and sees this, that in the comments, in the question box, there are several thanks for her courage and strength and for providing her testimony, telling her story, giving insight. And so I just wanted to make sure everyone heard that we brought those up and that Kerri heard those thanks.
Yes, and thank you everybody for your comments. And thank you for caring. This is a new conversation that people are actually caring what happens inside of there. For so long, you know, like I told, we've been so re-victimized by the system, and for people to actually take their time to care about, you know, trans women inside of these dark places means so much.
Thanks, Kerri.
Thank you. So just a few more things to wrap up. JDI has a resource guide for survivors of sexual abuse behind bars, which lists legal and psychological counseling resources by state for survivors who are still incarcerated, those who've been released, and loved ones on the outside who are searching for ways to help. If your agency is interested in being listed as a resource on JDI's resource guide, please fill out the form found on the link on your screen. We'll also include the link in our follow-up email, which you'll receive later today. And then I also want to encourage you to sign up for the second part of our series on helping transgender survivors behind bars, which will be December 10th, Wednesday, December 10th, same time. And that one will really cover, we'll have a couple advocates on who have worked directly with transgender survivors in different capacities, both legal aid and actually inside of a major metropolitan jail. And we'll go over the PREA standards specifically on transgender people's rights and working with transgender survivors in detention in much more detail on that webinar. So I encourage you to register, and we'll send out this link later on. And finally, I want to thank you so much for joining us today. Please take a moment to complete the evaluation and provide us with your feedback. It's very, very important. We take it very seriously, especially as we shape the next or future webinars. So the link to the evaluation is on the slide here on your screen, and you'll also receive it in an email later on today. Thank you so much. For additional information, visit our Advocate Resources page, which the link is up here on the slide. And, of course, direct questions to advocate@justdetention.org. And if you have any questions for Michael at Forge, just send those our way, and we'll make sure to forward them to him. And thank you again, and have a great day.